Welcome to another and very special edition of Scrubbedout Grand Rounds. And today we have a very special guest, Dr. Fay Leung. As you can see her on there. She is the program director of the UBC Orthopaedic Surgery Residency program, a very good friend of mine, and an amazing upper limb surgeon. We get to have her on the program today and next Monday, so make sure you tune into both. So today we're going to be talking about all things application related. So basically, what does the program and what does a selection committee look for in your applications? And obviously we have a little bit of expertise in orthopedics. However, that being said, this should apply to whatever program you're applying to. Next week, we're also going to have Dr. Leung back on, and we're going to talk specifically about nailing down those reference letters. So keep that in mind for next week. But for today, again, our main topic today is what do program directors look for in your residency application? So make sure you guys can ask questions. So make sure you guys submit your questions along the way. We're absolutely happy to answer them. We have Justin here. He's one of the medical students, pre-med students, and he's helping us out, so he'll monitor that. If you guys have anything to add, please join on. So Dr. Leung, welcome. Thank you so much for being here. Do you want to give yourself a quick intro?
Oh, sure. Well, thank you so much for having me, Adrian. I really appreciate having me. I want to tell you that your name has come up so many times. I get a lot of medical students asking about what orthopedics is like, and what the life is like, what are what's the OR like, what's residency like, and everybody knows Scrubbedout.com. It's actually been a huge resource for everybody. So a huge shout out to you for the work that you've done and really promoting, education in orthopedics, not only about orthopedics itself, but about the lifestyle and the training and everything around it. It's been so great.
Thanks for saying that. Obviously totally happy to do that. That's why we're here, right? We're all educators. We're taking your lead. You've been this amazing new program director for us. So we're really excited to hear what you have to say today.
Okay. Well, so first of all, to introduce myself, like I said, I've been an upper limb surgeon or a shoulder surgeon for quite a while, and sports and shoulder trained. And I work out of Richmond, and I've been teaching residents for quite a long time. But I've only been a program director. This is my first year as a program director. However, I've been on the RPC, so that's the Residency Planning Committee, for, oh my goodness, so long now. And I've been part of the selection committee for CARMS since the time that I was a resident. I think there's 1 or 2 years that I wasn't part of the selection committee, so I'm actually even ashamed to tell you how many years that is in total, but it's been quite a long while. So I've been part of the process for quite a long time and watched it evolve, and had a lot of thoughts about the whole CARMS.
That's amazing. Yeah, so that's perfect, because you're the perfect person to have. And, I'm on the RPC with you, so hopefully we can give a couple of nuggets here and there for people on here. So hopefully we have a lot of medical students, people who are applying. Again, we know that both the American matching program and then the Canadian one, the CARMS, is happening imminently. So we have to get everything done as soon as possible. So Dr. Leung, you are the program director. You will literally be selecting residents in the next few months. What do you look for in a resident? What do you look for in an application? How does somebody stand out among the peers? Because you're essentially getting the cream of the crop right now.
Absolutely. Well, I think the first thing to understand is that the decision is not mine. I chair the committee, I think would be the best way to describe it. And our committee, most committees now will be a mix of different people. So there's going to be staff involved, potentially some, obviously the faculty that will be teaching you directly. Some of the faculty are researchers, some of them are academic faculty, clinical faculty, and the residents have a huge part in it as well. We also have an EDI lead that is going to be part of our committee, has been for the last couple of years, and some of our admin staff, because they're also part of that team. So while I chair the committee, really there's a wide range of people that are looking at your application.
Then knowing that, is there a way that you can get your application or get the support of most of the people, maybe even before they get in there?
And so I think that this is an important thing to think about what we're looking for. And I think, this is where I'm going to veer a little bit and talk about driving.
Nice.
Okay, I'm going to talk about driving because I think that it's really easy to understand what the normal parameters of driving are, right? You want someone who is going to know what the speed limit is, and know what the rules are of the road, be able to engage with the other drivers. And I would say that that's what we're looking for as the norm. And then on top of that, we're looking for really good drivers. So someone that you feel really safe with, right? The Uber driver with 5 stars, you get in the back of the car and you know that you're going to get where you're going in a safe fashion that makes you feel safe, that makes you feel comfortable. Maybe you have a nice conversation along the way, you have a good ride, right? So how do you show yourself to be, someone who knows the speed of traffic, knows what all the rules are, and still stand out for yourself? Well, this is where it becomes really hard, right? And I think that this is here. Let's talk about the standards of what we usually look for, and we usually are looking for 4 things. Those things are your exams, how have you been performing academically, your reference letters, your CV, and on top of that, your research. Now, we're not specifically looking for those things. We're looking for what those things mean, right? So you don't necessarily have to have all of those things, but you have to understand them, and you want to know what those things mean, right? So, I mean, for example, your grades when you're going through medical school. Well, sure, yes, it's easy to say we want to see good grades, but what does that actually mean? It means probably, and again, that's that concept of probably, right? We think that probably if you're doing well in medical school and in your undergrad, that you know how to learn, you know how to extract information from lectures or from textbooks, and you're able to demonstrate that knowledge through exams and maybe apply them. Now, all these are inferences. Right, we're assuming that those are true, and that may not be. So if you're someone who, for example, really, I bombed out in my first year.
University was terrible. Don't worry, so did I.
Right, we do.
Worry, guys, you can still do it.
But what does that say about you? What did you do about it? And that would be part of my academic story. Well, hey, you know what? I had particular circumstances, and then I learned from that. And then I was able to demonstrate that I had these skills. Or maybe you're not a great test taker, but you can demonstrate that you're able to obtain information, you're able to collate information and apply information in a different way. So how do you show that if not through your grades? You have to know that, right? Does that make sense?
No, absolutely. And whatever your personal story is, you have to be able to weave that into your application. So either in your your personal statement, and then also in terms of creating that narrative for yourself, so that anyone you talk to, whether it's a reference or even on your application, your interview day, you are kind of have those talking points, right? It's like talking to the media. You have to have talking points, and you have to have a narrative that shows what your strengths are, right? So like Dr. Leung said, I mean, when I started and I did my applications, I was a little bit unfocused when I began my undergrad. So I didn't have the best grades the first couple of years. But, when I finally decided I wanted to do medicine, which was not until 3rd or 4th year, I really picked up the slack, and that was part of my narrative. So that's, I think, a really, really important thing that Dr. Leung touched on is like, you have to make a personal statement and your application personal to you. And I think maybe that's a really good starting point. And it requires a lot of reflection. Would you agree with that? I
absolutely do. And one of the things that I don't want you to take away with here is that there's a recipe book for getting into residency, exactly. Right? There's no recipe book. It really, and if you try to make it a recipe book, it becomes inauthentic, and it doesn't reflect you. And it just doesn't pass the sniff test. We can see that, right? So it really does have to reflect your personality, what your values are, and let's get to that. Let's talk about that a little bit. I just put a little note down to talk about narrative and talk about adjectives and talk about injecting your own personality so that you have your own story. And that's I think it's important to know that your story matters greatly. I'm very fond of telling medical students that if you are applying in Canada and you get into a program in Canada, you are at a huge advantage. You're going to do well. You're going to be a good orthopedic surgeon. You're going to have good training. Don't worry. Okay, it's really not like some other countries where there's quite a variety in training. We've got a great college. The Royal College sets the training standard that we all have to meet. How we meet that is a little bit different. So there's different flavors, there's different culture, and that's what you're really getting to choose. But in terms of knowing that you're going to graduate and be a good orthopedic surgeon, hey, if you're in Canada, you're doing. I'm assuming that most of our audience is here is in Canada, but
Canada, North America. So same thing goes to the United States too, right? Absolutely, yeah.
So really, making sure that your personality matches the personality of the program that you're applying to is important.
On that note, I remember specifically my very, very first interview that I went to was at Yale. And in my brain, I'm like, oh, there's no chance I'm matching here, right? International medical graduate, all these things, right? A little bit of that imposter syndrome. But the program director, the first thing that they said at the time was the interview process is also a very stressful time for the institution and the program, because we also want to put our best foot forward to you. And as an applicant, you now have that ability and to kind of, like Dr. Leung said, choose and make sure the fit is right, because just like everything out there, each program has an individual personality. So you do have a choice, and you should pick the one that kind of feels the best for you. Like Dr. Leung said, no matter where you train in North America, you're going to be well trained. It's going to be good, right? And it'll only be better and improved if you find people that are kind of like-minded and can kind of boost you up.
It sure is. I mentioned, put those things out forward first, the exams, the reference letters, because that's the thing that we're looking for in the package. But I would say that overall, what we're looking for, even above that, what all of these issues really relate to ultimately is whether or not we can trust each other, actually, right? Because the whole concept of education and conferring knowledge and you picking up that knowledge is about that mutual relationship, and that mutual relationship is something that we have to feel that ability to build on that. I really have picked up on that word trust since we had a grand rounds last week. And if any of you are interested, I really highly recommend you go on the Orthopaedic website for UBC and look in the archive of grand rounds and look for Dr. Frick.
From Stanford.
From Stanford.
Wonderful person.
And really, what an amazing talk! And it's entitled "When do you get the knife?" Right? Yeah. And it really is built on that concept of trust, and that the trust is just on a microcosm of when I feel comfortable conferring a very responsible task for you, a very important task for you, be it looking after a patient on the ward, looking after someone in the emergency department, or operating on them, right? Looking after them afterwards, taking care of their family. All of these things, just for us to give that responsibility to someone, you need trust to do that. And then ultimately, though, even going beyond that, we're trusting our graduates to look after our families, our community, ourselves as we get older. So we have to be able to have that trust. And similarly, for someone to be able to learn from me or learn from you, Adrian, right? They have to trust that we have their interests in mind and that we're going to work hard to be able to bond with them, to be able to come to their level and confer, that really critical education. So that relationship is really probably above everything else what we're looking for.
Absolutely. So it's like the whole vibe. And on that note, actually, Dr. Leung, I'm going to interrupt really quickly. We have a question from Julian who says, hi, how would you describe the culture and the ambiance in the UBC Ortho program? I'm going to throw a quick a plug in there because we have our first virtual info night on November 30th. So again, check the UBC Orthopedic Department of Orthopedics website for that. But Dr. Leung, how would you describe our culture and ambiance?
Sure, absolutely. We recently held an RPC retreat where we talked about what our strengths are. And one of the strengths really is our faculty. Our faculty is really dedicated. It's actually quite amazing that we have a very diverse and distributed faculty. Not everybody works at the same hospital. And despite the difficulty that you might anticipate in getting people to connect from different places, we still get such a great core group of people who come together because they're dedicated to resident teaching. We recently had some elective residents come from different cities and different programs who really remarked on how dedicated our staff are and our faculty. So I really think that's a huge strength of our program. And we are one of the bigger programs. We have 25, 27 residents any given year. So that is also one of our strengths, in that we have so many people that are around to help you and connect with you and that are part of your team. This is part of your educational group, that cohort that you're moving forward. So whatever is a strength can also be a weakness depending how you spin it, right? I mean, I often say, well, what are the strengths? Well, strengths are how diverse we are and how distributed we are. What's our weakness? It's how diverse and how distributed we are. So absolutely. It's really how you decide to put it.
No, wonderful. We talked a lot about finding the vibe, finding the culture, the ambiance, and making sure you mesh with the people there, right? And hopefully you know this because you've done an elective there or two. So, Dr. Leung, let's go into each one specifically. So the first thing you said was academics, right? So, how well you did on your standardized exams, your research. Tell us, how much weight does this hold, and how does somebody showcase at the best?
Absolutely. I think, again, we can talk about just passing the driver's test, right? Like your basic driver's test means that you're safe to go. And that means that you passed everything, and then you've got your requisite things. And then where do you show your brilliance? Where do you show that you're actually, hey, you're the 5-star Uber driver instead of, my son who's, oh, sorry, Ben, who's just got his L. And so, every different person is going to have their different highlights. And this is, again, where knowing yourself and knowing what your particular strengths are particularly important. But let's just talk about the bar. Let's just talk about passing. So let's talk about the CV and what that means, right? I mean, if you have a CV that just, hey, you just did the bare minimum, you just went to medical school, you showed up every day, and you went home and you didn't do anything, well, that's fine. But what does a rich CV really, why do we look at that? Why do you think it's so important? Of course, the easy thing to say is that we look for well-rounded people, right? Of course we do. And why do we look for well-rounded people? Well, part of being well-rounded and part is actually knowing what your values are, right? Knowing the things that matter. And presumably, you're not going to go volunteer at, the SPCA if you hate animals, right? So in part, it shows what your values are, what the things are important to you. And in part, it kind of it shows a little bit of resilience as well, and that that you have things in your life that you appreciate, that you love, that make you feel good. Residency is tough. You remember that. Totally. Residency is tough. There's no question about that. I'm not going to sugarcoat that at all. It's hard work. But knowing that you have a support system, knowing that you have things outside of medicine that you are invested in, that make you feel good about you, that you have an identity in something other than medicine, I think is really important. I think that's what the CV for me shows. There's other more granular things that we can talk about, like, for example, hey, if you were part of a sports team and you went into higher level team sport. Well, we're going to infer that maybe this says that you play well in teams, that you know a bit of adversity, a bit of physical pain, So
which residency is.
And you know how to cope with that. And the thing about team is also particularly interesting, right? Because why is a team so important? And there's that really. I mean, orthopedics is a team sport. Surgery is a team sport. And if you've been on a team for many years, you know that you can't just be the prima donna. It's not one person that's a prima donna. Yeah. It's really about helping each other achieve a common goal. And for us, that common goal is patient care, right? So we substitute the ball or the score at the end of the day, or the championship for good patient care.
Yeah, no. So I remember when I was on the selection committee, and we had several types of CVs with varying degrees of educational, competency or experience, and varying degrees of research. But to your point, and to what we were talking about earlier about creating that narrative for yourself,
yes.
Like Dr. Leung said, I remember specifically, we had Olympic athletes who are, the only thing on their CV was, I'm an Olympic athlete. But again, that shows a lot of things like commitment, hard work, team play, things of that nature that, certain programs may find important. On the flip side, you have the complete opposite person who has literally 100 articles of publication, right? And again, that shows the exact same thing, but just shows it differently.
It's in a different way. Yeah.
Right. And so if I may just kind of paraphrase or kind of put it all together, the research and the education is kind of your foot in the door, right? It shows that you have those basic competencies and the basic skills, that will be important in residency. Is that something you would agree with?
I would agree. And some people say, oh, I haven't played sports. Oh, but I played the piano to a higher level, or I did something else.
Exactly.
And I think Adrian, what it would be really great for this is a pearl. You and I have talked about interviews before, actually, is what does that say about you? What's your narrative? What is the adjective that you would take from that experience that really defines who you are? Yep. And if you're able to distill that into a word or 3 words and give that to me, this is your package. This is who you are. that you'd stand in really good stead. That would be a really great interview.
Yeah, and that's an amazing thing, because that's something that I think you and I both really enjoyed talking about, is like brand building and kind of strategy. And if you guys have, get the opportunity to kind of reflect and do exactly what Dr. Leung just said, that I would highly, highly recommend that. To paraphrase and sum up what we just talked about, the first couple of things we talked about was, academic excellence in publication and research. Really, that is just an indicator and a marker for the program to say that, yes, you have these basic competencies, but they're not the most crucial thing, because you can show them in different ways, such as, if you play team sports, you're an Olympic athlete, you have some kind of other commitment or hard work, you sit on boards, for example, things like that are also really important.
Now let's talk about research for a moment too, because again, that's something that we specifically look for. There's a line item on that we look for.
Yes, that's right. Yes.
And people often are very anxious about this, because you may be in a I see Femis on here. I mean, if you're from Mac, man, you've got
that's right. You better have 100 research papers.
You've got a lot of opportunities there, and if you're from a different program, you may not have those opportunities. And so there is a degree of anxiety for people who who don't have that, or they came to orthopedics a little bit late. And so now, let's go back to what research means. Why do we look for research? We look for research because it is a surrogate for understanding that you have demonstrated sustained interest in orthopedics, and you have some degree of knowledge as to understanding or insight into what orthopedics is. Now, having said that, now you understand what the purpose is. There's a bunch of different ways to show that. Keeping in mind that research is a Royal College marker, right? That like you have to do some research in order to get through your residency. Not every orthopedic surgeon is going to be a researcher, and most programs know that and they understand that. And we're not looking for everyone to be researchers. I mean, the world just wouldn't work that way. But we're looking for the surrogate, what that means. So say you didn't do any research projects, or you wrote some little case study. That's okay. How else have you showed sustained interest and commitment to orthopedics? Now, why is that important? It's that concept of lifelong learning. Do you remember when you graduated from high school? And I can almost every high school graduation says something like, "Oh, your world has just begun," right? Your life has just begun. You're like, "Damn, I just finished. I just finished. I want to finish this."
Yeah.
But I think that what people that are interested in what you're doing, it really is not a flash in the pan. It's not something that you do for a couple of years. And showing that early dedication and commitment demonstrates that you're probably going to be one of those people that is committed to always learning, always advancing, always pushing forward. Someone who's not just going to be passing the bar, but someone who's really going to look towards mastery and then excellence. I love that you said that, if you're doing the same thing 10 years into practice that you did when you graduated from residency, maybe there was something wrong. And I think that really speaks to your mentality of constantly evolving, constantly looking for growth. And I think that is something that, as not just for a residency program, but for our culture in orthopedics, our profession in orthopedics, that's something that we need to be looking for. Yeah,
and I was going to say, hopefully that's something that you'll get it when you come to residency at UBC. But you mentioned something that I want to make also really clear. And one of the things you said in terms of research, you wanted to show that you have some long-term interest in orthopedics. But I also want to put out there, though, that medical school is short. Clinical rotations are short. You're only probably getting maybe like 4 weeks, maybe 6 if you're lucky in any given program on orthopedics. So you may not even know you like orthopedics until literally a couple of weeks before
100%.
The CARMS match. And this is real life stories that have happened, right?
100%.
Don't be worried, because that's okay. Again, we understand that people, have last minute interest because you've never been exposed to it before, right? And that's okay to kind of switch. Again, and we'll talk about this maybe next week when we have Dr. Fay Leung back here, but there's ways to get around that where you can, make calls and have people advocate for you to say, hey, yeah, no, this is a real thing. This is not just a backup. They really switch their interests. But that being said, though, everything you've done to date, in terms of the research and the education, all that still stands, right? I mean, it still shows the same traits. You just have to now make, and we'll talk about this next week, but you'll have to make people believe that you are genuinely now have a new interest.
Yes.
Yeah. And
absolutely,
yeah.
I would absolutely agree. And again, I don't want to stress you out if you came late to this. I don't want to stress you out if you don't really have publications.
Yep.
What I'm telling you is this is the reason that we look for them. If you don't have them, if you're not in that lane with that, then you want to know how you can demonstrate that in another way. This is what we're looking for. We're looking for commitment. Okay, I haven't shown that in orthopedics, but this is why, and this is how I've shown that commitment to something else in a different way.
Totally.
This is why I've had a change of heart, right?
Yeah,
So
exactly.
So you can talk about that. I mean, I like the reason that I give you the traffic analogy is because sometimes you're going a little slower, sometimes you're going a little faster. You know what the speed limit is, right? And if you know what the speed limit is, you can explain. Yeah, you know what? I was escorting an emergency situation behind me, and I had to go a little faster. Or, there's a deer ahead of me. I had to go a little slower. So, know what the speed is, and so that you can explain, or you can tell a good story as to why you're a little bit different.
Totally.
And we actually do appreciate different.
And so we just talked about kind of research publications and academic expertise, or academic excellence. The next thing I want to talk about is another thing that I always get asked: to be truly considered at a certain program, do you have to have done an elective there?
Okay, great question. So all of the things that I told you are things that we see on paper. CVs, exams, reference letters, all the research or research publications, all of those things that you show on paper. But one of the really important things are the things that cannot be measured. The things like how much you care, right? How much you care, you can't see that on a piece of paper. How professional you are, how prepared you are for any given day, any given case. How much of a team player you are. What your situational awareness is doesn't come up on paper, right?
That's absolutely correct.
Like all of these things are things that I wish there was a form for that, but there isn't. And so when you do show up for an elective, really that is your opportunity to showcase those abilities and for you to see if you appreciate your program's situational awareness and
Absolutely.
Responsiveness and all that stuff. And I wish there was a better way to do that. There isn't, and so that's where that elective piece is so helpful. Now again, when you can't have that, you can't have that. So how can we make up for it? How can you show up for that in different ways? And again, this is something that's a little bit more difficult to do that. But if those are part of your adjectives, then you add those to your introduction letter. You add those to your interview, for example.
Also, like Dr. Leung very aptly said earlier, everything is a bit of a double-edged sword, right? So remember, if you are going to go on elective, make sure that you are everything that she just said, and not just to your preceptor, right? I mean, everyone is a team, like when you come to a hospital, like we are a very well-oiled machine, hopefully. I mean, with all of our colleagues from, medicals, like local medical student, all the way up to the administrators, to everybody in between, right? So, if you're really nice to us, but you're really mean to somebody else and you're not professional, I mean, we will absolutely know about that, right?
You bet. It comes up in funny places. It comes up in funny places.
Yeah, it really, really does.
I want to go back to something that we talked about before about trust, because when you show up, you want it. What do you want to show? And I would say that again, that trust thing that trust word is going to be really important for me again. And I think that one of the best pieces of advice that I ever got when I was I think it was in medical school, and one that I pass on frequently to people who come close to me, are that we are looking here for good orthopedic surgeons, or we look for the seeds of good orthopedic surgeons. And how do we see that? Well, we want to know that you're going to be a good resident. Well, how you know that? Well, so a good medical student is actually going to be looking for all of those things. What's a good resident? If I'm a medical student, if you're a medical student right now, you want to look for a resident that you admire, right? Because in 5 minutes, you're going to be a resident, and you want to be like that resident. If you're a resident and you want to be a good fellow, you find a good fellow that you like. You look for that mentor. You look even for a role model, and you be like that guy, or person, or woman, whoever that is, and you look for a good staff that you want to be like, totally. You want to emulate, and you start thinking, well, what are all the things that Adrian's amazing? What are the things that Adrian does? Well, I like the way that Adrian interacts with me. I like that Adrian, he's prepared for his cases. He knows his patients. He's kind to the people around him. So those are the responsibilities that you take. Hey, you know what? If my staff sat up there and set up the room, my expectations for the next case is I am there setting up for the room, right? You are looking for that next layer, that next level of who you're going to be, and you're going to be that person right now.
Absolutely. Right. And and some of the ways you can codify that or objective, at the beginning of a rotation really is sit down with your preceptor and set out objectives, and I've said this before on previous reels and posts and things, but I mean, like, if you sit down and do an objectives day, just set out objectives for the rotation, you essentially have a blueprint of what that preceptor is looking for. So just do that. It's like a cheat sheet, right? And so it's like little things like that about, absolutely keep working hard, but you just got to be strategic and work a little bit smarter to do that, right? And exactly like Dr. Leung said, find those people that you really look up to, that you think are doing a great job, latch onto them, mimic them, and make them responsible for you. So one of our other doctors, Dr. Mike Neufeld here, he always says that make one person responsible for you, and make them feel responsible for you by doing a really good job for them. Yeah, and that'll get you really, really far. And I think that's a really good idea.
Yeah, and you do a really good job for them by standing alongside of them and doing the things that they're doing. Hey, you know what? You're hanging out with a junior resident and they're busting it, just doing consults. Hey, you know what? Can I take one? Let me do that. Can I take one? And I'll do the orders and I'll do the paperwork, and you can check me over once we're done, and that way I'm helping you and you're helping me, and we're a team together. And that's, I think, what people want to see, that development of that relationship, that development of that trust.
Absolutely. Take every opportunity you can. So another thing, there's a question earlier about, what is the culture here at our institution, University of UBC Orthopaedics, like? Well, if you come here or whatever elective you're doing, talk to the residents, talk to everybody you can. Talk to the residents, talk to the staff, talk to the people you're not even working with. Talk to the nurses, talk to the physios and the occupational therapists, and see, what is the culture like there. And then, it's a great way to find out, right? And for me, anyways, it would be a bit of a red flag if the program did not give you kind of like unfettered, access to all the residents, right? Because, what are they trying to hide, right? So when you come see us, we're like, talk to everybody, see if you like it, right?
So I'm going to put it right out there, two things. One, residency is hard. We were talking about that. This life is hard. Let's not mince words about that. It's hard. But you really, anything that's hard, anything that's difficult, it's made more meaningful by working with people that you like, right? Totally. And this is where choosing your team for us and for you is really important. And I had a second point there. What was that? I forgot.
We can come back to it.
We'll come back to it. Yeah.
But we can move on to the next one. So, so clinical experiences, I think we agree, yes, for both, actually you more so than us, because you get to experience what it's like. Would you agree with that?
Yeah.
Yeah.
I would completely agree with that.
The next one, really interesting. We're going to talk more about this next week, because I think it's a really important topic, is letters of recommendation. But remember, the letters are just the letters, and you have an X amount of those ones, right? But what's really important is getting vocal supporters who will make phone calls, who will do things like that, right? And that's kind of like the next level, working a little bit smarter aspect of it. Do you want to so how important are reference letters, Dr. Leung?
Okay. Yeah, this is something that's really hard for you guys, because a good reference letter is one that you never see, right? So there is a piece of blind faith that you put in someone's hands when they write a reference letter for you. Yeah. I would say that reference letters are part of the algorithm. They're not the entire part of they're not the entire decision maker. So don't worry about that part. In general terms, of course you want someone to speak highly of you, and perhaps again injecting a little bit, someone who you've had a personal experience with, not just someone that you've seen in the hall a couple of times, someone who you've really actually been able to identify with, someone who can actually speak to your skills or your particular attributes is really important. We do take them into account, but it's true that we really do look for people that you've worked for and who can speak to you. And I'm actually sometimes surprised, like we said, the stories that come out that when you're not looking.
Yes, absolutely.
So, I have had, for example, residents who've done poorly on the match based on something that happened on an off service.
Wow, crazy. Right.
So those things matter. And again, this goes to being genuine.
Yes, absolutely.
This is really important.
Yep. Yeah. Be nice because you're really nice.
Well, yeah.
No, that's really important. That and ultimately too, because actually you just made a great point. All these things are on paper, right? And so your authenticity will show through, if nowhere else, at your interview, right? When we actually do meet you in person or virtually or whatever, but see you face to face. So tell us a little bit, Dr. Leung, how do you ace an interview?
How do you ace an interview? Well, so I would say that, okay, let's go with the speed of traffic again.
Okay.
All right, let's go with the speed of traffic. And what do you think that every single person is going to say when you get asked that you get lobbed that question? So, Adrian, why do you want to be in orthopedics?
Yeah. Oh man. Probably something along the lines of, I want to help people, and this is that. Was something that I've wanted to do since I was a kid, and a lot of kind of, I don't know what the word is, like those like kind of vague statements, like what tropes are they? Like tropes maybe? I don't know. I wasn't an English major, but yeah, those.
Right. Or you had an injury when you were a kid.
Right,
and,
yeah. I think I said that.
I don't. And I certainly don't want to minimize those stories,
right.
Because but you also really want to be able to inject a part of yourself in that.
Yes.
Right? How am I different from what Adrian just said?
Absolutely.
Right? How is my story different? And I'm not looking for it necessarily even different, but authentic, because I'll tell the same story as Adrian will tell, but we come from different backgrounds, and truly there are nuances there that are different, right? My values are somehow different. The way that I've approached this are different. Are you able to, can you challenge you between now and January, right?
Yeah.
To really find your adjectives. Right, find 3 adjectives that really describe you. And then from that point, everything that you do, you want me to understand those 3 objectives.
Yep.
So the things that you put forward from this point, they reference back to those 3 objectives.
Your
And
talking
that's
points.
what is talking about authenticity, right?
Absolutely.
It's that, hey, you know what? I value teamwork. I value the people that I work with. Well, and this is how I've shown that. And you want to hear about my volunteer experience, or you want to hear about how I respond to adversity. Well, yeah, in my team, like this is because this is me. I know my 3 adjectives. I know myself really well, and the things that I do reflect those 3 adjectives, and I'm able to tell you that story.
The power in reflection and the power of building that narrative is that you actually then, the wheels have turned on what is your values based on those things. How has that changed you, and how has that really directed you, and how is that different than the next person, right? And that builds that extra layer of kind of like reflection and introspection that I think is really important as an orthopedic surgeon, right? I mean, we're just like hammering out cases, you have to really kind of reflect and say, how did I do a good job? How can I improve? What can I do differently next time? How can I adapt and evolve? So, by being able to do all those things and bring that into an interview session, not only does it make you stand out because you're standing out and a little bit different, it also shows us that you have those abilities to succeed in those kind of non-technical ways, if that makes sense.
It shows so many things. I think
Totally.
it shows organization.
Absolutely.
It shows prioritization.
Yeah.
Right. I think it really shows your pillars as to what the things are that are most important to you, and that you're willing to push for.
I would love to actually, for us maybe to sit down, because we both have at a different talk about how to build a narrative, how to kind of build those 3 keywords, and how to create talking points, because that's so important. And you can really tell in an interview the people who have prepared like that and the people who haven't, because the people who are prepared, they kind of circle back, and every point, every sentence comes back to those 3 things, whereas somebody can just kind of go off on a tangent a little bit. My example that I always give, is the number 1 question people are always going to give you is, tell me a little bit about yourself. And the worst mistake you can do is spend 4 minutes of your 8 minutes, like half your time, being like, well, I was born right here in Vancouver, and then I went to elementary school down the road at Queen Mary, and this and that. That is not what we are here to know about you. If that is important to you in terms of why you decided orthopedics, then absolutely. Yeah. But the opportunity there is to really build that framework and build that storyboard of who you are, right? They give you a blank slate to say whatever you want to say and basically start your story of you.
That's exactly right. And that really kind of brings us back to the beginning when we're talking about, hey, this is why we're looking at your CV. This is why we're looking at your academics. Is we're looking for is finding all these pieces in our brains. We're putting together a narrative about you, but even better if you're able to serve it on a platter to me and say, hey, these are my things.
Yep. Absolutely. Why did you do the PhD, or what did it mean to you to be an Olympic medalist, and how come you have decided now to become an orthopedic surgeon? All those are really big questions that you have every question is an opportunity to set yourself apart, which I think is really important.
Yeah.
We do have one more session. Sorry, next week we're going to talk again specifically about reference letters. I think it's a huge topic, and the deadline for reference letters is coming up very soon. I think for both Canada and the United States. So definitely tune in next week, same time. As a quick recap for us, we talked about today, what's important and what do program directors and selection committees look for on your application. So we talked about academic excellence, we talked about research and publications, clinical experience, letters of recommendation, and vocal advocates. A little bit. We'll talk more of that next week, and then how to ace your interview. A lot of that. We also talked about kind of finding the culture of the program, seeing if you fit, and crucially. Developing that narrative for you that will kind of, weave through your entire application, from all the paper stuff, all your CV building, which itself is also another discussion, all the way through to your interview. And we've had the wonderful expertise of orthopedic surgery residency program director, Dr. Fay Leung. Dr. Leung, do you have any final parting words? While you're doing that, I'll say if anyone has any questions, please put them in the chat as well.
I think you summarized that beautifully, Adrian. That was perfect. And I hope that was helpful for you guys, and I hope that you're able to implement some of those skills.
Well, thank you, everybody who tuned in for spending an evening of your free time with us. That was really appreciated. So we will, remember, see you next week, 5 p.m. Pacific time. Dr. Leung, who is the UBC Orthopedic Residency Program Director, is going to be back on. We're going to talk a little more about reference letters and maybe even building a narrative, because I think that's a really cool topic. So absolutely, we'll see you guys next week. Thank you. Have a great night.
Good night.
Bye.